nursing care plan, which is your modifiability of the problem. So the modifiability of the problem refers now to the ability of reducing, controlling, or eradicating the problem. And in terms of the modifiability of the problem, we have to identify your resources. Okay? Sapat ba ang resources ng community to eradicate the problem? Sapat ba ang resources ni nurse para makatulong in eradication of the problem? And sapat ba ang resources ng ating facility to eradicate the problem? Okay? So if all of this, okay, if all of these are present in the criteria, then most probably the condition is highly modifiable. So kung doon sa family nursing care plan, this is just a 3-category scoring, 0, 1, 2. Ito po, 0, 1, 2, 3. Isn't it? So 0, not modifiable. Then next is what? Low modifiable, moderately modifiable, and highly modifiable. Score is 0, 1, 2, 3, respectively. A repair, yes. Comparing doon sa community, sa family nursing care plan, non-modifiable, moderately modifiable, low modifiable, then high modifiable. Tatlo lang. Okay, dito 4. So it's not low, moderately, and highly modifiable. Are we clear? Are we clear? Yes. So that is your modifiability of the problem. And the score of this has the highest weight, which is 4, with making it the priority criteria in identifying the priority problem in your community of nursing process. And the next one is your preventive potential. Preventive potential refers now to the probability of controlling or reducing the effects posed by the problem. So preventive potential, tignan natin yung severity, is the condition already affected majority of the population. Kasi kung more than 50% na affected, medyo mas mahirap na i-prevent. Isn't it? But if it's less than 25%, then the preventive capability of the problem is higher compared kapag mas marami ang affected. Okay? Also, we need to consider yung nature ng the problem. Yung bang problema, madaling makahawa, like for example, communicable disease. Okay? It's really hard to stop something that you can see. Isn't it? Yes. Okay? And the last one is social concern. In comparison now to your family nursing care plan, your social concern refers now to the perception of the community. And talk about perception of the community, that's your social concern, while in the family nursing care plan, the perception of the family is known as your salience. Naalala po ba? Yes. Then why it was given, by the way, this is course 1, and this is course 1 as well. So, para natin sa score, the problem is not identified as a problem by the community, hence hindi siya kailangan bigyan ng solusyon. Or, ang problema ay identified, but it does not require an urgent attention. And scores 2, kapag na-identify ang problema and they think it requires an urgent attention. So that is your social concern. We are including this in the process. Why? Let me go back to the primary goal of community of nursing. What is the primary goal of community of nursing? Enhancing the capability of the people. Is that the same thing with self-reliance? Yes, meaning we want the people to decide on their own. Therefore, in the process of data gathering, collection, collation, presentation. Why? Because we want to present the data to the community, and the community, together with the nurses, are going to decide. But mostly, decision makings will be done by the community people, while the nurse is just giving support or assist in terms that they don't understand some of the concepts. Are we clear? Are you sure? Okay. Then afterwards, okay, ito po yung ating scoring. If you want to take note of this. Excuse. Palina ka sa pictures here. Okay, and this is the second one. Okay. Marami kalabas sa exams dito. I'm sorry, Miss Banag. Nagkakil na Banag na niya. Palalabasin na ba natin siya?
Yes!
If we really want to follow the rules, isn't it? Palalabasin na ba natin?
Yes!
Is that a majority decision?
Yes!
Miss Banag, paano ba yan? Ang madla na ang nagsalita. Pag madla ang nagsalita, wala na akong magagawa. Miss Banag, you are out. You have been evicted sa bahay ni Joel. Why is it wet? Kaya pala ayaw gumana. Buti pa siya wet, ano? Basa, oh. Saan ko siya sinuksok? Kaya pala sira na naman, bibili naman ako ng bago. Okay, so steps in conducting community diagnosis, aside from the prioritization computation, we also need to consider these things mandated by the government. Okay, so mandated by the government, especially by the World Organization, wherein our program should also focus in addressing these concerns. Number one there is your air pollution and climate change. So balang araw, baka naman bigla ka magtayo ng iyong foundation. Yung foundation mo, naglilinis ng mga ilog. Ganon. Okay? What else? So, nung nagpuna tayo ng Happy Hollow, isn't it? Pag ito ng Happy Hollow, wala nang naglagay sa inyo is dirty surroundings, untidy, puro nga pa niyan, ang kapatang identify nyo doon puro health status problem kasi nga increase number of houses that does not, parang ganon, present. So pwede naman yun. Ang program nyo, i-align nyo sa pagkakaroon ng changing the community through the climate change. Pwede naman non-communicable diseases. Ito siguro related din sa mga na-identify nyo. Mostly sa inyo, nakaroon ng mga problems like your hypertension, isn't it? Yes. May mga cancer, diabetes, ayan, non-communicable diseases yung mga yan. Tama? Yes, non-communicable diseases. Parang masama ang loob sa akin si Tito, no? Ang ganda-ganda ng upo ko sa harap. Ganda-punta niya ako sa dito. Tapos tinabi niya pa ako sa may jowa niya. Dito na tayo. Marinas ka, sir? Threat of global influenza and pandemic. Nangyari na ba? But this was actually written 2019. Then the following year, actually, in the same year, to be exact, December 2019, nangyari yung pandemic. So, yung trends, parang alam ng World Organization, no? Hindi kaya sila rin may pakana. Fragile and vulnerable settings such as regions affected by drought and conflict. Napapanood nyo, some places in Germany, alam nyo yung lake doon, yung Great Lake na lumabas na yung mga lumabog na barko. Tapos in China, they have the longest drought in history. In China right now, they're having heat wave. Kasi nga, it's been months na hindi umulan, all the rivers are already dying. Okay? Then people are actually going to caves, always laging nagsiswimming, kasi nga it's really hot. Are you watching the news? Manood din kasi ng balita, wag puro darna, tsaka lulumba. Okay, yung ano ba yun? Yung kay Daniel Padilla sa Kaipan? Tapos na ba? In fairness naman, na-appreciate ko dun sa pinapanood kasi ng mother-in-law ko. Na-appreciate ko yung mga procedures na ginagawa ng nurse sa hospital, at least near the ideal. Hindi ka tulad sa GMA na hindi ko ano yung GMA kasi talaga minsan na mag-visit ka din, parang talagang literal, aramigan tinalaing buya ang tanga. Tapos nakasasya. Kung tatanga-tanga ka, ganda naman mag-is ng GMA ko na. Documentary wala natalo sa GMA, of course. Mas may credibility naman ng mga newscaster doon kasi sa ABS. Okay? Antimicrobial resistance. Are you familiar with this? You have to. Di ba marami na tayong ganito? I was actually waiting na mayroong mag-research sa inyo regarding the antimicrobial resistance. Okay? Baka sana ni-research nyo yung idea, yung awareness ng mga tao sa paggamit ng antibiotic. Bakit? Antimicrobial resistance. Di ba man develop ng antimicrobial resistance? Nakakaway kong nanay ko dahil dito. Alam ko yung nanay ko may stock ng antibiotic sa bahay. Kung ano, basta inubo yung mag-antibiotic. Nagalit ako, tinapong ko lahat, nag-away kami. Okay, ganun yun, sakit na nanay ko yun. Kaya feel ko nga, pag nakasaktan si nanay ngayon, tapos mag-antibiotic siya, mahirapan kami. Baka may resistant na yun. Okay? Ebola and high-threat pathogens. Kaya nga doon sa MS nyo, sino na ako ng Ebola? Meron ba dito? Ay, sa kabilang section. Okay? Weak primary health care. Compared to other countries, our healthcare is really weak. But I should say may improvement naman. Especially the implementation ng universal healthcare. I don't know if you are aware already that we already implementing your universal healthcare. And that's one update pala. In your syllabus, nung last semester, pina-include ni Dean, in-identify namin yung mga included international comparisons. So we have included mga sustainable developmental goals, syllabus. Then pinapa-edit niya ulit ang syllabus namin. Kailangan daw i-connect na namin siya sa universal healthcare. Walang katapusang revisions. Ganun talaga. That's actually us trying to meet the parameters set by the evaluators in order for us to meet the standards. Hopefully, cross finger. Next year, we are already among the top universities. That is on the list. Kasi kung siguro naman, we are among the top universities, especially here in Dakar. However, we are not on the list internationally kasi nga hindi pa tayo nakapa-evaluate. So yun lang naman ang kulang. That's why the University of Baguio spend a lot of money to do that. Okay. And vaccine hesitancy, meron pa din. Sa matter of fact, sa ating vaccines, at least nasa 90% na ang ating vaccine coverage in terms of the COVID-19. Pero first and second dose lang yun. Marami kasi nakareceive ng second dose ayaw na for third dose. Kayo pa boosted na?
Yes.
I'm into my third dose na. Third dose ng booster. Meron pa daw, diba? Wala na ba? Kakaroon pa lang ata. Meron yata. Wala pa ba? Ay, nauna kami. That's how important I am. Dengue. Dengue was actually first diagnosed in the Philippines. That's why it is initially known as Philippine hemorrhagic fever. So is that something that we need to be we can be proud of? Like when everything about dengue, oh, the Philippines, you know, di ba? Tayo lang pauso niya. Of course, hindi lang kami available sa Pilipinas, di ba? In Amazon, meron na yan. So first lang siya na-diagnose sa Pilipinas. Okay? And of course, the human immune deficiency virus. A very scary disease. Okay? If you have, but of course, if your friend, if you know someone who has, we have to stop the stigma. Okay? Hindi ka naman po mahahawaan ng HIV kung makikipag-usap ka lang sa kanya. Unless you are friends with benefits. Gerger kayo ng gerger. Tapos wala pang condom. Okay? So, yun. And meron tayong, di ba sinabi ko sa inyo, may bagong treatment tayo, ay meron tayong prophylactic for AIDS. Like, you can take the medication prior. So, para safe ka kahit walang condom, magipag-sex ka kahit kanino, parang ganun. And ikaw, kung gusto mo naman, if you want to be the promiscuous woman, so be it. Make yourself make yourself available, di ba? Kung gusto mo, ngayon, sinigang ka bukas, kari-kari ka naman, gano'n. It's really up to your choice, okay? It's already 9:45, I'm gonna stop the discussions here. Though, some of the contents here, I'll be including in the quiz. Kaso, alam ko kasi may uploaded videos na ako nito. Send ko na lang sa inyo. Okay? Do you have any questions?